of some cancer types in low-income countries. As you can see, some of the cancer types we don't see here too often. They are more common in low-income countries. Cervical cancer, hepatobiliary cancer, stomach cancer. These are more common in low-income countries. In the United States, we mainly see breast cancer, lung cancer, colorectal cancer, prostate cancer. These are more common. Mortality, if you look at it, dramatically high mortality from hepatobiliary cancer, cervical cancer, and gastric cancer. So it tells you that the rates of cancer and the kind of cancer that you see and the mortality rate is very, very different outside the United States, primarily in low-income countries. Now, good news is we have made substantial progress in terms of caring for our patients. In fact, mortality from cancer has gone down substantially, not only in high-income countries, but also in low-income countries. So this is between 2000 to 2010, and as you can see, mortality has gone down by 6% in low-income countries, 2% in lower middle-income countries, 12% in upper middle-income countries, and 13% in high-income countries. So, good trend. If you look at mortality from tobacco-related cancer, lung, oropharyngeal, head and neck, esophageal cancer, it has gone up a little bit in lower middle-income countries, but by and large we have been more successful in most other places. Same thing with infection-related cancer, such as cervical cancer, hepatobiliary cancer, gastric cancer. We have made substantial progress in the United States and internationally. So that is a good sign. Now, if you think about this, so approximately 20 million new cancer cases are expected to occur by 2025. However, the largest increase in the number of cancer cases are expected to be in low-income countries. So there is estimated 14 million new cancer cases in 2012. Of them, 8 million people died. So a substantial number of patients who had cancer end up dying. Now this is a chart that shows cancer incidence and mortality globally. So if you look at the incidence standpoint, as I explained to you, the breast cancer, prostate cancer, lung cancer, colorectal cancer, these are more common in high-income countries. In low-income countries, you have a lot of patients with stomach cancer, as well as hepatobiliary cancer, cervical cancer, esophageal cancer. Prostate cancer is less common. It is 4% here compared to 12% here. So if you look at the incidence, so half of the cancer, almost 48% of all cancer cases, they occur in Asia. If you look at mortality, more than 50%, almost 55% of mortality occurs in Asia. Now, Americas, they account for almost 20% cancer cases, but 15% of deaths from cancer. Same thing with Europe. Almost a quarter of all cancer cases occur in Europe, and 21% of deaths occur in Europe. On the other hand, if you look at Africa, 6% of all cancer cases and 7.2% of all cancer deaths. So as you can see, the number of cancer cases and mortality standpoint, the larger number of patients who are affected with cancer in low-income countries, they end up dying from cancer. Question is, what can we do about this? As a matter of fact, we do have proven interventions that can improve outcomes in a number of cancers. For example, if you look at all those tobacco-related cancers, you could come up with a program to decrease the prevalence of smoking. We could vaccinate patients with HPV or HPV vaccine, and they can substantially reduce the cancer cases. H. pylori-related cancers can go down. So there are a number of things that can be done that can help improve prevent cancer? The answer is yes. In fact, up to 50% of the cancers are preventable. It is interesting to see tobacco alone kills 6 million people each year. Can you imagine that? The number 6 million people every year. Can you imagine any drug that will be legal if it kills 6 million people in a year? Right? It is unreal. Now, unfortunately, 80% of 1 billion smokers in the world live in low-income countries. Isn't that outrageous? Now, that will tell you that the largest number of tobacco-related cancers will occur in those countries. Countries where they don't have resources, they don't have doctors, they don't have radiation therapy machines. Alcohol use, it kills over 300,000 people. Head and neck cancer, esophageal cancer, liver cancer, and it has been associated with breast cancer and colorectal cancer. Recent data suggests that even moderate level of alcohol consumption is harmful. Infections. Approximately 15% of all cancer cases are from infection. Now, there is dramatic geographic variation of infectious attributable cancer, from less than 5% in high-income countries to almost more than 50% in some of the African countries. So 50% of cancers from infection. All you have to do is treat infection, and you can halve the incidence of cancer in those countries. Question is, what can we do? Can we ban smoking? How many of you think we can or we should? So in the United States, in fact, we have made a lot of progress in terms of reducing the incidence of smoking. In Europe, smoking is still highly prevalent. And there have been recent legislation changes in Austria that is expected to increase the smoking rate. However, if you look at this country, this tiny country, can anybody name what country it is? It's in Asia, that is the hint. Bhutan. That is correct. Oh my goodness. You guys got A in geography. So Bhutan has banned smoking since 2012. So if you go to Bhutan, if you smoke, you have to buy cigarettes in black market. And if you are caught by police, you go to jail. So Bhutan has done banned smoking. It's interesting. Now, so there are some of the cancers, right? The infections and alcohol and tobacco that can cause cancers. How about palliative care? Palliative care is simple. It's easy. It is cheap. And as you know, most of the patients who have cancer, they will end up requiring palliative care. Unfortunately, in low-income countries, there's hardly any palliative care in the availability. Pain control is still at the core of the palliative care services, and morphine is cheap. It is one of the cheapest drugs available, and it works for more than approximately 90% of patients with severe terminal cancer pain. Unfortunately, there is poor access to care in most of the countries outside the United States. On top of that, the major problem with global cancer control is lack of global initiatives. So when we talk about global issues, we talk about infections, we talk about malaria. But do you guys know that non-communicable diseases are the commonest cause of death in low-income countries? Infections are not the commonest cause of death in low-income countries. Antibiotics are everywhere. So doctors can prescribe antibiotics, pharmacists can give antibiotics to patients, and infections are pretty well controlled there, yeah. Much better than before. So only 1% of $30 billion assistance for health in 2010 was for non-communicable disease. Only 1%. And very little for cancer control out of that. So there is lack of technical assistance, the lack of support for research, and it has been a substantial, significant barrier to cancer control. So Dr. Aju Matthew from University of Kentucky, he did a fantastic job. He published this paper in Journal of Global Oncology. As you can see, the new cancer cases per oncologist, right? So in the United States, we have one oncologist for less than 150 new cancer cases in a year. Now, large number of these the countries that are green, they have one oncologist for more than 3,000 patients, or no oncologist at all. Many of these countries, you see, they have 151 to 300 patients for one oncologist. And for example, countries like India, they have almost 500 to 1,000 patients per oncologist. So it is very hard for those oncologists when you see 10 new cases. I mean, I don't want to see more than 2 new cases here, but you can imagine when you have to see 10 new cases, how are you going to provide care? How are you going to focus on research? You simply don't have time to focus on research. Now, so not only you have lack of oncologists in all these countries, even if you have oncologists, there's dramatic geographic variation. For example, if you go to India,